Care's Oral Care and Denture Care training. My name is Jenna Silva, and I'm your narrator for today's training. Care Providers Responsibilities, Oral Care and Denture Care Training, Diamond Care Inc., Caregiver and Service. So the purpose of this training is to maintain resident comfort, dignity, and health, prevent infections, pneumonias, and mouth pain, understand the differences between the different types of dentures and denture care, and learn how to respond to a resident who refuses oral care. This is a requirement of the State of California's Department of Social Services underneath Title 22. Caregivers must assist with personal hygiene, including oral care under 87464 underneath Basic Care Needs and Services. Care provided responsibilities and why oral care is important. So oral care can lead to mouth infections, gum disease, tooth decay, difficulty for our residents to eat and swallow, which then results in other big health problems for them, pain and discomfort, and increased risk of aspiration pneumonia. And aspiration pneumonia is where they silently inhale or go down the wrong pipe into the trachea, food particles, water, excess saliva. And when we have all that in our mouth and we bring that down into our lungs, it can make us extremely violently ill and lead to death. Residents who cannot complete oral care independently must receive assistance from care providers. And so that's what today's training is all about. When oral care should be done in the morning, after meals if possible, before bed, especially after vomiting, and when we remove dentures. So residents who are bedbound may require oral care multiple times a day because they might have a higher tendency of pocketing food, not clearing their mouth out all the way, and that can just sit and grow bacteria. So the basic supplies that you're going to gather is a toothbrush, toothpaste, disposable gloves, towel or a bath bib or a Chucks, a cup of water, dry rinse if that's ordered, denture cup if it's applicable. And for our bedbound patients and our patients who are maybe on hospice and are not eating and drinking as much, we're going to do the oral swabs. If we have a suction available to us, sometimes hospice will provide that for end-of-life care, and a water basin. So standard oral care procedures. Wash your hands and apply gloves. Explain the procedure to the resident. Assist the resident to sit upright if it's possible. And we're going to brush the teeth and the gum line gently. And then brush the tongue lightly if you're able to. And we're going to make sure that you rinse our mouth out really good with water and mouthwash. We're going to dry the mouth and lips, and we're going to remove gloves. And if we have it available and it is the client's personal hygiene item, maybe some lip balm. And so for our clients who are bedbound, we are going to make sure that their head is up at a 90-degree angle. We're going to use the oral swabs or a soft toothbrush, small amounts of water. We're going to monitor for choking, and we're going to apply lip moisturizer and ensure the mouth is free of excess food and debris. So here is a video on how to perform oral care.
When buying hot dogs, you want to pay right away. But buying big game tickets, that's when you probably pay later.
Good morning or good evening, and welcome to my YouTube channel. In this video, I'll be demonstrating the CNA testable skill provides mouth care. This skill has one critical element step number 8, which requires the testing candidate to clean all surfaces of the teeth, including the tongue. So, if you forget to clean the tongue, you will automatically, you will not receive credit for this step, and you will automatically fail the skill. So you have to remember to clean the tongue off.
And just remember, this video is for testing out for CNA Home Health Aid purposes, but it's got very important steps for you to look and see if you're doing oral care properly.
Okay, so without further ado, let's go ahead and get started. So the first thing I'm going to do is perform the opening procedures. Come in. Good morning, Ms. Carla. My name is Julie. I'm your CNA, and today I'll be helping you brush your teeth, okay? All right, first I want to perform a quick safety check. I'm going to give you your call light right here. Your bed is in a low safe position. Bed walls are locked. I'm going to go ahead and provide you with privacy. And I'm going to go ahead and raise your head of bed to a high Fowler's position, okay? Now, in your Nurse Aid Candidate Handbook, it says to raise the head of bed between 75 and 90 degrees. What is 75 degrees to you may not be 75 degrees to the NAE. So I tell all my students, raise the bed as high as it can go, closer to 90 degrees, okay? All right, Ms. Carla, I'm going to go collect my supplies and wash my hands, and I'll be right back, okay? The supplies that you will need for this skill will be 1 pair of gloves, a cup, an emesis or a kidney basin, 1 toothbrush, toothpaste, a towel, and a washcloth. So I'm going to go ahead and gather up my supplies. Place them on the table. Hi, Ms. Carla, I'm back. I just need to go get some water, and I'll be right back, okay? Okay, Ms. Carla, I am back. Now, your overbed table has wheels, so you will want to make sure that you have your supplies close to you, okay? So you won't have to keep walking back and forth, okay? It has wheels, so you move this around wherever you need it to be. Okay, Ms. Carla, I'm gonna go ahead and put my gloves on, okay, for infection control. Just gonna make a clean area on my table with the washcloth. And I'm going to put this towel across your chest, okay? So to make sure I don't get any toothpaste on you. Now your book specifically states to use a cloth towel. If you use a washcloth or a Chucks, you will not receive credit for this step. It has to be a cloth towel, okay? The washcloth I use as a clean area to place my toothbrush on, okay? So I won't have to hold it all the time. So now I'm gonna take this new toothbrush, unwrap it, throw it away, if I can get the paper off. Paper sticking on my hand. You'll want to moisten your toothbrush in the cup. Place toothpaste on the toothbrush. And you see I didn't fill the toothbrush up with toothpaste, only a little bit, okay? All right, Ms. Carla, go ahead and open your mouth for me. And I'm gonna start cleaning the backs of your teeth, the side, up front, and behind your teeth. And now I'm going to move on top to clean your top teeth, making sure I clean all surfaces. Okay, now here's the critical element step. Ms. Carla, could you please stick out your tongue so I can brush your tongue? Yeah, stick your tongue out for me. There we go. Brushing the tongue. And when you brush the tongue, make sure you state, I'm brushing the tongue. Now that I'm done brushing her teeth, I'm going to go ahead and place my toothbrush down on the clean area I made with the towel. You have to hold the emesis basin. No. You don't hold. You have to hold the emesis basin to the person's chin. Okay, Miss Carla, go ahead and spit out for me. Okay, and there's some water for you to rinse your mouth. Do you need to rinse again? Okay, and more water, and rinse. Okay, you need to rinse again. Okay, now I'm gonna go ahead and wipe the person's mouth. Don't forget to do that. If the person wipes their mouth or if the person holds the kidney basin, you will not receive credit for that step, okay? So you can do like I did to Miss Carla. No, 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 you don't hold it, I will hold it. Okay, Miss Carla, I'm gonna go ahead and remove my, or dispose of my soiled supplies. I'm gonna go ahead and place my cup in the trash can here. And as you see, I'm leaving her in an upright position. I'm not going to waste time rolling her bed back down, her bed back down. I'm gonna make sure that the soiled linen does not come in contact with my clothing. I'm going to dispose of the soiled linen. I'm going to empty the basin, rinse my toothbrush. I'm going to dry the basin. Place my tooth.
So in that video, you saw the basic steps of performing oral care. Yes, that was for somebody who was getting ready and preparing for like a state nursing CNA exam, but those steps are what we should be performing in real life, right? If our resident is able to hold the basin, allow them to assist. But a lot of times it's best that we do it for them so that way we can eliminate a potential risk of making a mess. So this next video is about a 3-minute video, and it's on how to perform oral care on somebody who is not conscious. And so, you know, when we have hospice patients and they start to make that transition and that descent, that does not mean we stop performing oral care. Oral care is still performed, and it's performed to help prevent infection and potentially choking hazards.
When your kid's fever hits right after bedtime, you
The next skill we're going to perform is unconscious oral care. For this skill, you will need a waterproof barrier for your work surface, a towel, an emesis basin, mouthwash solution, 2 cups, 3 oral swabs, a padded tongue blade, and lip balm. You're going to wash your hands and apply gloves before beginning the skill. My unconscious resident is already positioned on her side with a pillow behind her back. I will always assume that my unconscious resident can hear me, so I'm always going to talk with her and let her know what's happening next. Hi Beth, my name's Mari. I'm your aide today. I'm here to do your oral care. I'm going to put the head of the bed up a little bit, and I'm going to get things positioned. I'm going to put a towel under your face in case there's any drainage. We don't want to make a mess of her bed. Next, I will take the emesis basin and place it near her chin and under her mouth to help collect anything that drains out of her mouth. I will start the oral care by using a solution of 1 part mouthwash to 3 parts water. I'll take the first oral swab and get it wet with mouthwash solution. I will use the oral swab to clean the outside of her teeth and inside of her cheeks, always making sure to keep the oral swab in her mouth. Once I've cleaned the outside of her teeth and cheeks, I'll place the oral swab in the basin, and I will use my padded tongue blade to place it between her teeth and hold her mouth open if her mouth is not open on its own. I'll then obtain the next oral swab with mouthwash solution and use it to clean the inside of her teeth, the tongue, and the roof of the mouth. After her mouth is clean, I will use my last mouth swab with water, and I will wipe around the entire mouth to help rinse the excess mouthwash off. Then I will remove the emesis basin and use the towel to dry her face. The last step will be to apply lip balm as long as my patient is not on oxygen. We don't use petroleum-based products with oxygen, as oxygen is combustible. Next, I will clean up my supplies and remove the towel. The towel will go in the laundry hamper. I will make sure that I put the head of the bed back down to 30 degrees and place the call light in reach of Beth. I'll clean up my supplies, take off my gloves, wash my hands, record, and report.
Okay, so I hope that helps you guys to understand how we do oral care on an unconscious person. This next video here is with a dementia-esque expert by the name of Teepa Snow. Teepa Snow, I had the privilege of meeting her years and years ago when she came to Walnut Creek. And I remember sitting the first time in one of her lecture and services thinking, wow, I never put these pieces together when it came to my neurocognitive impairment residents, patients, and clients. And so I highly encourage you guys to go check her out online. Just the way she spins things and explains things really helps you with that understanding. And so she's going to explain to how to brush a person's teeth who have neurocognitive impairments and how to help them remain independent while doing so.
For no matter what crosses your path, get coverage confidence with AAA Insurance.
So here's Emil. So you right-handed or left-handed?
Right-handed.
Right-handed. Okay, so turn this way a little bit so everybody's going to be able to see us. Now, before I had you do hand under hand, right? Now what you're going to learn how to do is be the fine motor when they're losing it. The tool manipulation. So the reason I want her hand is her brain remembers her hand coming to her mouth. The reason I need my hand is she doesn't know how to manipulate a toothbrush anymore. So what I'm going to do is do the toothbrush. She is with me, and by being over here to the side, guess what? She literally thinks what? She's brushing her own teeth. Notice that I have my hand on her shoulder applying downward pressure. I'm tricking her mouth into not paying as much attention. Now you notice Emil's a little bit tender around here. She's not real fond of this. But let me take away the hand and watch what happens. Much more intense because I'm actually tricking her brain. This is close and it's proximal, and so I'm actually tricking her brain into paying attention to the pressure on her shoulder. Now watch this. So does it make a difference? Yeah, so I want each of you, and here's the deal. If you're going to be really good at this, you have to master both sides because you will have residents who are opposite dominance of you. And it doesn't matter what your dominance is. You have to use their dominance unless they've had a stroke, and you may have to use the remaining side. The reason you want their dominant side, that's where all the brain history is for fine motor tasks. Only one half of your brain has learned fine motor skills. The motor memories are not available on the other side. And so I've got to be on this side. It's also where it's going to draw her eye. Search and rescue will always tell you if their right person is right-handed, they'll make right-hand turns. If they're left-handed, they make more left-hand turns. It's an automatic behavior of the brain. So she will look at me more and pay better attention if I'm on her dominant side. So with your partner, give it a try. Try it out.
Okay, so I hope that little technique is useful for you guys. And so Teepa does a lot of different trainings on different scenarios on how to help people with neurocognitive impairments. And so those videos are very useful. And so practice using it. We've got a couple of residents who already are considered almost at advanced stage. And so, if they're struggling to brush their teeth on their own, pay attention to what their dominant side is, and let's try that technique. Okay, so this is another video on end-stage oral.
In the late stages of dementia, many residents can still participate in their own care and should be encouraged to do as much as they can. Some residents at this stage, however, may be totally dependent on you to do their care.
Would you like to try a little bit more?
It is best to provide care when the resident is up, unless they are more settled in bed. The best time is right after a meal, as most residents are not agitated when they are being fed.
And now we'll look after your oral care.
If care is delivered while a resident is in bed, ensure that the bed is rolled up and that the bed rail is in position. Oral tissues at this stage are often dry with thick, heavy mucus secretions that make mouth care difficult. A water-based gel should be used to moisten tissues. Often, food is pouched inside the cheek and must be removed gently with a moist cloth wrapped around your finger.
A little bit of that lunch there, you're saving up there. I'm just going to clean that out for you. We're going to just give yourself a nice cleaning.
Any remaining teeth and mouth tissues should be cleaned gently with a soft, moistened toothbrush.
Oh, you're doing a good job.
No toothpaste is used, as swallowing problems are common at this stage.
Nellie, can you just open up and stick your tongue out for me?
The mouth should be assessed daily. Fungal and other infections become more common in residents who have multiple health problems. Any signs of infection should be reported immediately. If an infection is suspected, toothbrushes and other oral care devices that come in contact with oral tissues should be discarded and replaced by new ones.
Okay, so keep in mind, if a resident does have oral infections, we need to get that treated and looked at immediately. And we also should be throwing out their old toothbrushes, at least every 3 months. And if they do have that infection, we need to change that toothbrush out more frequently. So, a majority of our seniors are going to have probably some form of missing teeth. They're going to have dentures. They might not have dentures. Many seniors, they don't like the feel of the dentures, so you'll see them what we call is gumming it. And so if we have residents who have some missing teeth, broken teeth, or no teeth, we might need to make some other food arrangements to ensure that they don't potentially choke. So there's what we call is the full denture. They have no teeth, okay? These replace all the uppers and the bottoms. And then we have partial dentures that replace several missing teeth and attach to existing teeth. And then we have implant supported dentures, and these are more stable. They don't require adhesives, and when we pull them out, we don't pull them forward, right? And we should never be pulling dentures forward. We should be putting our fingers along the tops of the gum denture line and applying gentle pressure down. And so that's what we should definitely be doing with these implant dentures, because they literally have metal rods screwed into their head and their jawline that holds these dentures in place. And then there's sometimes, a resident might come back, with temporary dentures. These dentures are more fragile and they're not meant for long-term use. So with denture care, we're always going to wash our hands, wear gloves, remove the dentures. We're going to probably have them rinse their mouths with a little warm water first, and then try to remove the dentures, because that's going to help the denture adhesive loosen. And we're going to rinse the dentures in lukewarm water, brush them, clean the gums and the mouth before putting the dentures back in. And we're going to make sure the dentures are really clean and good. We never want to use hot water, okay? And we never want to wrap the dentures in tissue. You want to make sure they're cleaned thoroughly. place dentures in a cup for nighttime overuse. And we're going to want to make sure that the label is on the cup, and then store them at the bedside. Okay. Every resident who has dentures really shouldn't sleep with dentures in their mouth. It could cause a potential choking hazard. All right, so this next video is going to show you how to safely perform denture washing care.
The next skill we're going to perform is care for dentures. The supplies that you'll need for this skill are a waterproof barrier for your work surface, a towel, an emesis basin lined with a paper towel or washcloth, dentures, toothpaste, a denture cup lined with a paper towel that has a labeled lid, a denture tablet, and a denture brush. To begin the skill, you will apply gloves. Next, take your towel and place it inside the sink to create a cushion at the base of your sink. You will go and collect the dentures from the resident and place the dentures in the emesis basin. Adjust the water temperature so that you have cool water running. You will take the toothpaste and apply a small amount to the denture brush. Take the lower denture plate and you will start by cleaning all of the surfaces of the denture. Make sure to hold the denture in the middle of the base. Do not squeeze from the outside edges. That will cause the denture to break. I'll make sure that I clean the chewing surfaces of the teeth, and then I will turn the denture over to clean inside the ridge. I will rinse the denture and place it teeth down in the bottom of the cup. If I need to, I can apply a small amount more of toothpaste and get the top plate of the denture. I'm going to start cleaning the outside surfaces of the denture and the roof of the mouth, making sure to clean all chewing surfaces of the denture. I'll then turn the denture over so that I can clean the inside, making sure to clean all the grooves in the top piece of the denture. And I will rinse that with cool water. It will also get placed in the denture cup, teeth side down. I will place a denture tablet inside the cup underneath the dentures and fill the cup with cool water. I'll turn the water off, put the lid on the denture cup, and place the cup at the back edge of the sink. At this point, I will clean up my supplies with the dirty linens going into the trash. I will take off my gloves and wash my hands.
Okay, so I hope you guys noticed in this video that she did place a towel into the sink. And here is why. Dentures can be slippery. They're kind of a silk, like porcelain type of thing, and they can, when you're with, gloves on, be very prone to falling out. And you don't want them to fall into the sink, all right? That's where we wash our hands, kind of gross. But not only that, they can potentially break, okay? So be mindful of those steps. Okay, so this next video is from Aspen Dental, and it's going to talk about how to remove dentures and how to use adhesives.
At Aspen Dental, we've spent over 25 years crafting dentures and helping patients feel confident in their smiles. That expertise means we're here to offer more than just dentures. We're here to help you feel comfortable every step of the way. Today, we'll walk you through how to master your denture adhesive routine. Whether you're new to adhesives or just need a quick refresher, these simple tips will make your routine easy and stress-free. First, make sure your dentures are clean and dry before applying adhesive. This ensures a clean application and helps your dentures stay in place comfortably so you can chew more easily. Now it's time to apply your adhesive. If you wear an upper arch, apply the adhesive in one long continuous strip along the edge of your denture. Then apply 2 shorter strips in the middle. If you wear a lower arch, apply the adhesive in a thin strip along the center ridge of the denture, focusing on the area that sits directly on your gums. For partial dentures, apply a very thin strip of adhesive on the areas that meet the gum. And be sure to avoid placing it on the metal clasps or any part that touches your natural teeth. With all dentures, avoid applying adhesives too close to the edges to prevent it from oozing once you secure it in place. Once you've applied adhesive to whatever denture you're wearing, position it in your mouth, firmly press it into place, and hold for a few seconds to help seal it into place. Here's one last tip to remember when applying adhesive. To avoid the mess and maximize comfort, start with a small amount. Too much adhesive can make it harder to clean and may interfere with the fit. If you find yourself over-applying adhesive, your denture may need an adjustment. When it's time to take your dentures out, start by rinsing your mouth with warm water. This helps loosen the adhesive, making removal easier. Next, carefully take out your dentures by gently rocking them back and forth with your fingers to avoid any discomfort. After removing your dentures, clean any leftover adhesive from your gums. Do this by using a soft toothbrush and a damp cloth or paper towel. Then, rinse your dentures under warm water and soak them in a denture cleanser. Here's one last tip to remember while removing your denture. For tough-to-remove adhesive, take it slow. Warm water and gentle cleaning are all you need to protect your dentures and gums. If you're experiencing any issues, talk to your Aspen Dental team for personalized advice. With these tips, you can master your denture adhesive routine with confidence. Have questions or need more guidance? Call us today or schedule a same-day appointment. We'll see you at your next visit.
Okay, so I want to point out that she did mention if, there is the need to use excessive amounts. If there's a need to if there's a need to use excessive amounts of denture adhesives, that means these dentures for our client are not fitting correctly. So we need to make sure we pay attention to that, and if that happens to be the case, then they might need to go have the dentures called realigned, and that pretty much means that they're just readjusting the fit so they're more secure. Now, as we age, our gums do shrink with or without dentures, but especially with dentures, and if they don't have the snap-on dentures, they'll really do shrink along with the bones, and that's why they started doing these snap-on dentures, is because it helps prevent bone loss. So if the dentures are not fitting properly, please let us know so we can make sure we get them in for a realignment. So signs of oral health issues, that's going to be bleeding gums. We're going to look for mouth sores. We're going to look for white patches in the mouth. That is usually called thrush, and thrush can be very painful and cause us not to want to eat. Loose dentures, pain while chewing, swelling in the mouth or in the gums, broken dentures, or refusal to eat due to mouth pain. So if your client shows any of these signs and symptoms, please report it to us immediately so we can get them evaluated by a physician or a dental provider. Okay, so here is another video on seniors and dental health.
What are common dental issues for seniors? As we age, our mouths go through changes that can lead to different dental challenges. Many seniors face issues like tooth decay, gum disease, tooth loss, dry mouth, and even oral cancer. Understanding these common problems can help you take better care of your oral health as you get older. Tooth decay remains one of the most common dental issues among seniors. Even though it is largely preventable, many older adults develop cavities, especially near the gum line. This is often due to gum recession, which exposes the roots of teeth that are more vulnerable to decay. Dry mouth, which is common in seniors because of medications or health conditions, reduces saliva flow. Saliva normally helps protect teeth from bacteria and acid, so when saliva decreases, the risk of cavities increases. Gum disease, also called periodontal disease, affects a large portion of older adults. Studies show about 70% of seniors experience some form of gum infection or inflammation. If untreated, gum disease can cause the gums to pull away from the teeth, leading to bone loss and eventually tooth loss. Conditions like diabetes can make gum disease worse and faster progressing, creating a cycle of health issues. Tooth loss is another significant concern. Despite advances in dental care, many seniors lose some or all of their teeth over time. This can happen because of untreated cavities, severe gum disease, or trauma. Losing teeth impacts not just appearance but also nutrition and speech, affecting overall quality of life. Dry mouth, or xerostomia, affects around 30% of seniors. It is often caused by medications used to treat conditions like high blood pressure, depression, or arthritis. When saliva production drops, it becomes harder to wash away bacteria and food particles, increasing the risk of decay and infections. Oral cancer is more common in older adults, especially those between 60 and 70 years old. It is a serious condition that benefits from early detection. Risk factors include tobacco use, alcohol consumption, and age-related changes in oral tissues. Regular dental checkups are vital for catching issues early. Other challenges include limited access to dental care due to lack of insurance, transportation issues, or physical limitations. These barriers can cause dental problems to go untreated and worsen over time. Systemic health conditions like diabetes, arthritis, or dementia can also make maintaining oral hygiene more difficult. For example, arthritis can make brushing and flossing painful, while cognitive decline can reduce the ability to care for teeth properly. It is important to remember that individual experiences vary widely. Regular dental visits, good oral hygiene practices, and managing systemic health conditions are key to maintaining oral health in older adults. Always consult with your healthcare provider or dentist for personalized advice and treatment options. Staying proactive can help keep your smile healthy and bright well into your later years.
Okay, so we've gone over the proper steps and techniques of doing different types of oral care. And we can do all the right things and our resident could potentially refuse oral care. So we walk a fine line when we are in an assisted living facility. We are at the end of the day responsible for their care, right? And that includes all of their care. But at the same time, they have the right of refusal, right? And so that's when we become good stewards of care and we try to find ways to get them to actively participate in the care that we're trying to provide. So when residents refuse oral care, remember to remain calm. It can become frustrating. Be respectful. Ask the resident why they're refusing. Maybe they're not feeling good. Maybe their gums hurt. Maybe there's something going on, right? Offer care again. Maybe they're not big fans of oral care right after they eat. Maybe they're not big fans of oral care right when they wake up and they need some time to wake up, okay? Offer a different caregiver if this helps, especially with our neurocognitive impairment residents. They are just like everybody else and they develop their own special attachments and likes to certain individuals, okay? Offer modified care. If they don't want to use that toothbrush, right? Let's try a mouth swab. Let's try mouthwash, right? And never force oral care because we don't want them to potentially choke. So on the refusal of care ADL sheet that will be in the MAR, we're going to date, time, care offered, residence response, explanation, of care provided by a resident and the follow-up attempt. Remember, you know, a good example note if you need to write a note down would be resident offered oral care at 7:30 p.m. Resident declined, stating that they were tired. Will reattempt later. Okay, but on our form, it's pretty basic and straightforward. But if you ever feel the need to do a handwritten document, we want to keep it straight to the facts and not opinions. Always wear gloves. So we're gonna, you know, go over some of this info again, and this really circulates around infection control. So we're going to wear gloves. We're never, ever, ever going to share toothbrushes, okay? We're never going to share toothpastes. We're never going to share denture creams, any of that, because that is our oral salivas and other things, and they may have infections, and now we're going to spread that infection, okay? We're going to clean denture containers daily. Okay, that means, you know, light wash. You take a warm cloth, wipe it out. We're going to wash our hands before and after the care, and we're going to dispose of all supplies appropriately. So here we are at the end, post-test review. Woohoo! You guys made it through oral care. I hope this helps you guys better navigate this difficult situation of providing oral care. It can be difficult, especially for your resident, right? They're probably not used to having somebody come at them with a toothbrush, right? And so hopefully that little tip from TIPA helps out. But once again, there's going to be a post-test review, 80% or better. If you have questions, concerns, come find us. We're glad to help.